word for somebody, because so often we think we don't have what we need, and God has given us everything we need to do everything He's assigned. And so when we started thinking about being spiritually healthy, obviously we also thought, the problem is we often stop there, and I believe that's what Pastor Travis was trying to talk to us about, that's stopping short, right? We want to be spiritually healthy. Yes, it's primary, it's preeminent, it's number one, but there's more. And so we have some expert professionals right here in the house. And so I'm going to invite them to come up. We have on our panel today, we have Dr. Samuel or Sam Jean-Baptiste. He is the radiation oncology chief resident physician. Come on, Tyler. We have Dominique Jean-Baptiste, who is a nurse scientist. Come on, a house of smart people. And speaking of smart couples in one household, we have Dr. Travis Rogers, chiropractic physician, and Dr. Jasmine Rogers. And so, we don't want to, come on, we don't want to have all these smart people in the house and not ask them the things that we need to know. So I can stop harassing after church and everybody can get the information. All right, so, I don't follow. Nobody said physical therapy. Well, no, there we are. Come on. So you got it. It's in the house. So listen, we have a list of some questions, and hopefully we will capture some information that is useful for us. And when we close, we're going to combine these two things that we've been talking about today, and we're going to pray over some family right here in the house. We're going to pray some prayers of healing right here before we even go. And so if you also are someone who is like, there's some things that I've been dealing with health-wise and I haven't quite talked about it, and I could use some prayer, we want you to go ahead and prepare your heart for that too, because we would love to be praying for you. So listen, experts, hey y'all. Thank you. So listen, I'm going to start with Dr. Sam. Is that okay? Dr. Sam, I'll start with you. As your focus, when we say oncology, we're talking about cancer, right? A word that we often don't even like to say in certain communities is kind of considered one of those taboo words. If we don't say it, it's not real. And so we want to talk about it. We want to kind of put it out on the table. So I want to just ask you a few questions. So in terms of cancer, in terms of oncology, what technology is currently being used to improve the cancer diagnosis and treatment, especially in marginalized communities?
Well, I think we should be using the word cancer a bit more frequently, because people don't know this is kind of scary, but 1 in 5 people actually develop cancer in their lifetime. So it's kind of scary, but cancer is a disease of old age. So as you get older, your chances of developing cancer actually increases. But some of the technology that are coming out there is we are now finding out a lot of different genetic mutations that we can actually target now. So patients a long time ago, everyone got the same treatment. Whether you're black or white, you get the same treatment, and because that's what the clinical trials were. And unfortunately, most of the clinical trials, only 3% of the people are actually black, so they don't look like us. So the treatments we're getting actually weren't tailored to us. But now, because of new technology, we're able to detect, especially for breast cancer and prostate cancer, new actually targeted mutations that we can actually target to treat cancer. Yeah.
First of all, you just shocked me. Did anybody know that 1 in 5 people develop cancer?
No.
No, you're right. Using that word is important. And so I'm gonna jump around. And so we have nurse scientist Dominique, and so her focus is on sickle cell. And so we want to talk a little bit about that. First of all, just the basic question, and I think many of us might have heard of sickle cell, and it becomes this thing that you're like, oh, it's common, but you don't know much about it. So what causes sickle cell?
Yeah, that's a really great question. So sickle cell is caused by a mutation in the material that produces hemoglobin. So hemoglobin in the body is responsible for oxygenation, so the red blood cells. So that mutation, causes the cells to, instead of the red blood cells being like a donut shape, they're like a sickle, like the farm tool, or a banana shape. And then they stick together, and that causes all kinds of complications. So ultimately, what causes sickle cell is that it's genetically inherited. So both parents need to have the trait for sickle cell disease for a child to be born with sickle cell.
I'm gonna ask this. So here's the thing, y'all. PT, before he was Pastor PT, y'all know, you know this story, because he married a budding artist wife who thought she was marrying a doctor, and then he said the Lord him told him something else. So these questions are very they're very in that vein, and I want to follow up a little bit, if you will allow me. I won't throw in any too big curveballs, but just want to follow up to that because that's important. So you're saying both parents have to carry the trait. So does that mean how do we know? Like if you're married, how do you know you're at risk for having a child with sickle cell?
Yeah, so in the United States, every newborn is tested for sickle cell trait. However, like, and we can thank the Black Panthers for that newborn screening actually. But so like there's been times when all the variants weren't tested for. So, if you're considering family planning, regardless of your race or anything like that, you should go and get tested for sickle cell trait. And not just like the common variants like the S and the SC. Also go get tested for the beta thalassemia, because that's like the only way you can know. You can rely on your parents. Your parents can say like, well, nobody ever told me that. But I've heard that so many times where people said that their parents told them that they didn't have trait, and it turns out they did, or they weren't tested for this or that variant. So it's important to get tested. And it's important to also know that like sickle cell disease is most common in people of African descent, but it also occurs in people of Mediterranean and South Asian. So without getting too into the weeds, like some people who have certain sickle cell trait, they are actually resistant to malaria. So sickle cell, the hypothesis behind why we have it is that, it is from those regions where malaria was most prevalent. So, that's why you have people of African descent that have it.
I had no idea. Okay, I know, right? So Dr. Jasmine, right? Let's go. We are talking about chiropractic medicine, right? So what common misconceptions are there about chiropractic care that you would like to just, because I know we've talked about this, because usually when we think chiropractic medicine, we just think like somebody like snapping your neck and you're like, that's the thing. And I think they quickly inform me like, no.
Yes.
so
well, we came up with a bunch of misconceptions, but on the topic of snapping and cracking, so we all know that there are the chiropractic videos of the crack, everybody getting adjusted and it's this crazy loud sound. The common misconception is when a person is getting an adjustment, there always doesn't have to be a sound. And so I know a lot of people are afraid to go to the chiropractor because of that. And so like there may be times where there is no sound. And if that is the case, then there's still some work that's being done at the joint level of the body. But the other point to that is there isn't just one way that a chiropractor can do adjustments. There are several ways that we can do joint manipulation, and like do the things that people feel comfortable with and that are safe with. So especially around the neck, I have several patients who are like, don't touch my neck. And I'm like, you got it. You got it. So there are tools that we can use that are more gentler or gentle. Y'all know what I'm saying. There are more tools that we have that can be more gentle, but still have the same great effect and pain relief and increasing joint range of motion and things like that. So there's not one way to do like the same thing, just so everybody knows. But find a chiropractor who is well versed in different techniques so that you can feel comfortable with, getting the different adjustments and things that you need.
So Dr. Travis, how can chiropractic care complement traditional medicine treatments? How can those things pair well?
All right, so with that was one of the things that we talked about where, like the misconceptions. One of the misconceptions is that we are anti-medicine or anti-surgery. Like that's not the case. We are very much pro for like when it's appropriate. So in terms of being on the spectrum of health, like a what's the word I'm looking for? Conservative care, like a proactive measure, like for people that are looking to go into surgery or people that have been told about surgery, like any surgeon or doctor that is trying to get you to a point, a good one is going to tell you to try any conservative measure first. So whether that's chiropractic, physical therapy, even getting with a personal trainer to strengthen parts of the body to keep you from, the ultimate goal is to keep you from getting surgery. So that's like probably the most thing. But
Yeah, thinking about how it complements, I was able to go. So I'm one of those people that was like, the first time I ever went to a chiropractor and I heard that snap, I actually screamed across the office and they were like, "Ma'am, you gotta stop." And I was like, "I'll never do this again. I'll never. This is crazy." And then I got pregnant and I could barely walk. And I will say, like, someone suggested going to a chiropractor, and I was like, "I don't do that." And it saved me in pregnancy both times. It just was so helpful in terms of like adding something before, because there's only so many medicines you can take. I was like, Tylenol's not doing it. And so just thinking about, there's so many ways, right, that conservative measures can kind of add to that. I want to jump back to where you got. I saw you listed.
I mean, I
Go
was
for
gonna
it.
say
Yeah,
something
please,
on,
yes.
on the top one because during pregnancy there are limited things that women can do because they have the baby. There's not a ton of medications that they can take, pain relief type things, and some women just don't want to. They want to take a more natural route to help help them with their pain. But especially during pregnancy, because there's so many changes that are happening in a woman's body, like there's a whole person growing on the inside of you, and there's things that are moving and shifting, especially in the pelvis, that can cause pain. And so conservative measures of chiropractic care can help with just decreasing that pain and actually helping to get the pelvis in a better position for labor and delivery. So there's no promises about you gonna have the fastest labor ever. There's no promises. I'm not gonna get up here and fool the people, but it puts you in a better position to have a safer delivery if you haven't taken those measures along the way. So from our ladies who are looking to get pregnant or all the things.
So, Dr. Sam, can you discuss any specific case studies or examples where some of the newer technology has increased the outcomes?
Yeah, so there was actually a case study that came out last year, I believe. So now there's these new drugs called immunotherapy. You guys have probably seen some of the drug commercials for like Keytruda and whatnot on the TV. So that's a form of immunotherapy. But the cool thing about immunotherapy is that as we're seeing right now, like our body's actually forming cancer cells, but they never become like clinically a problem because our immune system actually gets rid of them. Yeah, so we have these little soldiers in our body that takes care of it. But the issue with when cancer becomes a problem is because I'm gonna make a Harry Potter reference. It becomes invisible to your immune system, so it wears like a cloak of invisibility, right? So that's why they're able to evade the immune system. With immunotherapy, it removes that cloak of invisibility. So immunotherapy enables your body's immune system to attack those cancer cells. So last year there was a clinical trial. 12 patients enrolled for locally advanced colorectal cancer. And they were treated immunotherapy, and they all got cured from this. Yeah.
I know y'all got stuck where we all got stuck. But he said our bodies are producing cancer cells as we see it right now.
It's happening.
Everybody's making an appointment today. Everybody looks along like, so is there something that, I mean, and this is important information because I think if we knew these things, we would take it all more seriously, right? Instead of like, because a lot of times that fear does keep us from even finding out the information. So how can we be more proactive in dealing with like just the potential for cancer? If we're saying 1 in 5 people, right? How can we all be more proactive in kind of addressing this?
Yeah, so know your cancer screening guidelines, I guess. Talk to your doctors about your primary care doctors. Like recently, they decreased the screening for colorectal cancer from 50 years old to 45 years old, and even lower if you actually have increased risk from your family history. So some people might be able to get screened at the age of 40 or 35, actually. So same thing with breast cancer. If you have a strong family history of breast cancer, know that you can get screened before the age of 40. So just talk to your doctor about your family history, what's going on, so you know whether you're eligible to be screened or not.
Okay, that's good. That family history is
Um,
important. No,
I
please.
just want to add also like getting pap smears and that aspect of women's health is also important for detecting cervical cancer early.
No, that's good. How often? So, because we don't want to, some people know, how often should we be going in for these screenings? And at what age should women start to go see a doctor?
Pap smear, so it starts at the age of 21. So there is actually a couple of different guidelines. So at 21 years old, every 3 years. But if you get the HPV testing and it's negative, you can actually spray out to every 5 years.
Thank you.
And there's actually HPV vaccines out there that people should know about and, get injected.
Are those, do you find have those been proven so far to be safe? I know we see a lot of commercials about that.
Yeah, they've been proven to be safe and actually very effective. Actually, recently, they found out that HPV is no longer the majority cause of cervical cancer anymore. Like, also, it can cause head and neck cancer. So, because of the vaccine, it's been helping a lot.
Also, that head and neck cancer aspect is for men as well. So men are also eligible to get those HPV vaccines, and they should.
Okay. I don't think I knew that because I feel like it's often like marketed towards girls. Okay, got it. So in terms of sickle cell, we talked about just kind of what is it? So I'm gonna repeat some questions that I asked you because I didn't know. So in terms of like mortality, what is the ability to survive? Like how do you start to, what do the symptoms look like? And then what is the ability to survive? What's the mortality rate?
So as I mentioned before, like the sickle shapes, they travel throughout the body. So anywhere the blood flows, those sickle cells can go. And like, so the complications for sickle cell are head to toe. So like people with sickle cell can experience strokes as a result of like the basal occlusion in the brain. They can experience, one of the hallmark symptoms of sickle cell is debilitating pain that can pretty much manifest anywhere in the body. They can experience that they often have to get like hip replacements early in life due to, something called avascular necrosis happening in the bones and where the joints are. So there's a lot of different, and that's just like, there's, issues with the eyes and everything. So anything head to toe can be affected by sickle cell. So it's a very serious condition. And until there were some measures put in place in mostly Western countries, the survival rate for sickle cell disease was like people or children were not surviving past age 5. They were dying really young from infection. So now if you have a child that has sickle cell, that newborn screening is really important because they'll start your child on prophylactic vaccination or prophylactic antibiotics so that they can survive into adulthood. So, in the West, the survival, and, in certain Caribbean islands that also have newborn screening and access to the antibiotics, survival is into like the 40s and 50s, which is still very young, right? But in sub-Saharan Africa, in the countries that are like most predominantly impacted by sickle cell disease, the survival rate, unfortunately, is still, not even past age 5. Yeah.
Babies chimed in. They were like, "What happened?" Listen, they're fine. No, it's fine. It's a sign of life. Thank God. So just in terms of chiropractic care, what are some of the benefits? Because I know you guys, some of the things you were sharing, you do it a little bit. Your focus is on kind of functional medicine. Tell us a little bit about that. What does that mean? And then what are some of the key benefits of care? I think Casey got distracted.
It might be there.
Oh.
Check. 1, 2, 1, 2. All right. Okay, so
Let's proceed.
yeah.
What are some of the key benefits of chiropractic care that you've observed in your practice? And kind of explain a little bit about what you mean when you say functional functional care.
Right. So some of the hallmarks are like decreased pain, increased range of motion, flexibility, and stability. But one of the things we look for in our practice that may be different from others is something we call painless dysfunction. So almost echoing what PT was talking about earlier, like you cannot have pain, but you're not moving as optimally as you can. So if you start to stack these things up, little habits and things along the way, then you start to have those painful moments You start to have pain, you start to move differently, which causes more pain. And so it's like a big cascade of events that really have a profound effect on people's lives. And so a lot of times they don't come and see us until we're way past like 5 things have happened. And so we definitely preach proactive care so people can come in, they can get screened and not have to have a mountain of things to take care of.
Yeah, one thing I'll add to that is a lot of people think that, oh, I don't need to go to the chiropractor until I throw my back out or there's a car accident or something like that. But just to what Dr. Travis was saying, that's what I call him in office. That's
It's fine. Go ahead, girls.
what he was saying about the painless dysfunction. So, like, when a person comes to see us, we take them through a very, very intense, not intense, but thorough exam. And we make sure that we're looking at people head to toe. How well can your shoulder joint move? How well can your neck move? How well can you touch your toes? These are very simple things that everyone should be able to do. And yeah, say it again.
But they don't.
But they don't. And these are just some basic, simple, functional movements that we do in our everyday lives. And so if a person isn't able to touch their toes, like that is something that is quite alarming to us. It may not be painful. However, if you're not able to touch your toes, then it's very likely that you're not squatting. It's very likely that you're not running. It's very likely that you're not doing these things to benefit your cardiovascular health. So it goes just beyond physical pain. But if you are in pain, then you're not going to do the things necessary to prevent cancer. So this is why these things tie in so well together in prevention. I don't even know what the question was, but
Everybody now is about to go outside and try to touch their toes. How many of y'all already planning it? I know. I'm gonna recheck because I'm like, can I post baby? Everybody go home and try and touch your toes. If not, please reach out to Cairo Direct. Come on.
Health and wellness.
Health and wellness. You
Yeah.
can find them on Instagram and on the internet. Please make sure you call them today. Okay. Just in terms of thinking about, and I'm gonna do one last round of questions, and I'm gonna let you go. I won't hold you all. But in terms of thinking about cancer, I know we've been asking you a lot about technology because I know it's playing such a huge role right now in everything and in medicine and how we think about things. Are there any challenges that we're facing right now in terms of how technology is being integrated into cancer treatment?
Yeah, so there's a lot of red tapes and integrating new technology, as you guys can imagine, from the FDA. Also, clinical trials just cost like ridiculous amount of money, billions of dollars, and a lot of them actually negative. A lot of negative clinical trials come out. So as a result, it takes a while for things to come into market and affect us. But some cool things are coming into market, including like a lot of liquid biopsy stuff. So now you can go to your doctor and actually ask for a blood test called Shields to actually screen for colorectal cancer. And I thought this technology was like, 15, 20 years away when I was working on it back in 2018, but now it's on the market. So
Y'all heard him.
Yeah.
He said casual. Casual. That's what I was working with technology.
So in the future, there's going to be like more tests for this, just specifically for colorectal cancer, but now we're going to have for brain cancer, lung cancer and breast cancer as well. So these technologies takes time, but we're getting there.
So it's called Shields?
Yeah, Shield.
Okay, Shield.
Yeah.
Got it. All right. Are a lot of these things insurance specific, right? Can anybody ask for that, or is it kind of closely connected to insurance? I don't know if you know.
Yeah, if you meet the age guideline for it, your insurance should be able to cover it. But of course, check your specific policy because I don't know what your copay or co-insurance are.
Gotcha. Shield. All right. In terms of sickle cell, is there anything, right? So 2 questions. What disparities are people facing, and is there anything else you think we need to know? Like if you wanted to equip us with information we should walk away with about sickle cell.
Yeah. So I could literally sit down and talk about this forever, but there are a lot of disparities in sickle cell disease care in the United States. Unfortunately, even though, as I mentioned, there's like the differences, the global disparity in life expectancy between here and Africa, there's still a lot of disparities here in terms of access to care when you compare it to other genetic illnesses. Like people with sickle cell don't have as much access to comprehensive care. And also like when you look at, in medical school and nursing school, when you look at the textbooks, there won't be that much information on sickle cell disease. So as a result, like people who have sickle cell disease have a hard time accessing providers who are knowledgeable. So one of the things that, I want to educate you guys about, a resource that's available is there is a sickle cell nursing boot camp. So if you know nurses in your life that take care of sickle cell patients or are, faced with that and they want to come and find out more information at the University of, the University of Tennessee Health Science Center. We have a sickle cell nursing boot camp 2 times a year where all expenses paid. They can come out and for a week just get intensive knowledge on how to take care of sickle cell disease as a nurse. There's also like a lot of medical racism and misconceptions about sickle cell patients as patients right from the healthcare community. So anything that you can think of that impacts Black people in general impacts sickle cell disease as well. So sickle cell patients need social justice. So if you're interested in taking up those sort of causes, you can there's a organization called sickcells.org, and they have a policy forum where you can go and search whichever state and find out what's going on. They have drafted letters to the senators and all of that stuff, and you can get involved that way. And then the last thing I'll mention is that and this is relevant to cancer and any sort of person who's sitting in this room who might need a blood transfusion one day. Just generally, there's always disparities in access to blood. There's always not enough blood but for Black people, that's even, and Asian people and minorities in the United States in general, that's even worse because generally you think about blood types, but there's also something called antigens in your blood, and people who are descended from Africa have the most genetic diversity in their blood and the most specific matches that need to be done in terms of those antigens. So, if you're healthy enough to donate blood, I really encourage you to go and do that, because that helps people with sickle cell disease who often need blood transfusions, but then also people with cancer, people who are, having babies and they need a blood transfusion. When you get those matches more direct instead of it just being the surface blood type, then that, reduces the incidence that there might be some sort of reaction to the blood. So yeah, so that's just a few things.
No, that's good. Educating ourselves and giving, but we all see those trucks come around, right? Whether it's your job or it's outside of Walmart or Target somewhere. And I think that's one of those simple things. You have extra 45 minutes to kind of do something that can be life-saving. That's good. Thank you. And so final questions for you all. What advice would you give somebody going to seek chiropractic care for the first time? And then Dr. Travis, I'll ask you, is there any final thing that you would like to leave us with that we need to know? Can y'all still hear me?
What about now? Okay, great. So when you're going to seek chiropractic care, I'll just say this, there are so many different types of chiropractors, or so many ways that we can practice because of the scope. And there's many specializations that each office may have. So some chiropractors might like to specialize in nutritional things along with, the chiropractic adjustments. Some chiropractors are like, this adjustment will save your life. And that's what they believe. And then there's other chiropractors who are like, actually, we can do a little bit more as far as movement-based things that we can do. So as you're seeking out different chiropractors, just ask questions to see if their style of practice is actually what you're looking for. Because you could be going in thinking that you're going to get one thing and you get something else. And that's just the nature of our profession. Sorry. Because there's so many different ways that we can, the profession can specialize. But yeah, just make sure that the goals that you have in mind, if you just, if you are an athlete and you want to get back to your sport, or if you're just, if you're a regular person who wants to be active, play with your kids, or go for long walks or whatever it is, just make sure that those doctors or those chiropractors are actually going to help you reach those goals through the care that you're going for. Yeah. So ask questions.
Talk to your doctors. Talk to them, right? I think that's with any doctor. What's the gun that I said? Don't be alarmed. What's the gun that I said the lady used on me?
Activate.
Activating. So like I went. Remember I said I was nervous, and so I went and I said, I just want to tell you up front, I'm very afraid. And she was like, tell me why. And I said, because all I can hear is the sound of you breaking my neck with me being pregnant with my child. And she was like, well, that's never gonna happen. And she used something, the activated gun, which is a little different, right? It's a little gun that targets the areas, right? And so you never know. Like they told me they had that, and I didn't even know they had that. So it's just you ask for what you need, or express your concerns, right? These are people who are experts in what they do. And so it's good to always talk to your physicians and say what your concerns are, say what you're experiencing, so that they know how to help you or how to direct you. Dr. Trump, anything you want to leave us with around that we need to know around chiropractic care?
Yeah, I mean, I think the things between the two of you guys like settle out what I was gonna say, but no, it's good. It need to be said, so it can be said multiple times. But do your research, find out like what you're looking for, go into the office, like ask questions, ask patients or other people in the office like how their experience has been. Look at reviews online, like they can be like the most skilled people like at what they do, but if you don't feel comfortable in that space, nothing's gonna work. Like you need to be comfortable and feel secure that that's gonna happen. Do the homework if they give you homework, and Godspeed.
Oh, so the other thing I will say, yes, it is important because as far as like knowing if you're gonna mesh well with a doctor, because we are very hands-on, we're in your personal space. So you want to make sure that you feel comfortable with that person. I will say I recommended, or I sent one of my friends, close friends in Memphis, to a chiropractor there, and she went and she was saying that the man was a little extra handsy, and I was like, oh my God, like I did not know that this was going to be the case. So if you don't feel comfortable in a situation, be out. But just make sure that you can mesh well with the doctor because we are in your personal space. So yeah.
Last thing, if you go to a place and you don't feel comfortable, don't just stop there. Like there are other providers like in the area, so just go until you find one. Because we would say often, if you went to like a dentist and you didn't like that dentist, you wouldn't say that dentistry doesn't work. You just go find another dentist.
That's good. That's really good. Thank you all so much. Listen, I want to encourage you. I don't want to. Thank you. I don't want to assume anything of your time. So I'm gonna say, but I'm gonna half look at you all. If they've said something that you had a question about, so we're gonna maybe not a bombard, but a gentle, hey guys. And you want to ask me, there's some things you want to follow up on. I want to encourage you to do that. Like I said, God has given us answers right here in the house, and so it's such a blessing. So if there are things that you want to talk about, make sure that you stop by. These are things I think we didn't talk about anything that doesn't affect every person in this room, right? These are all things that can affect every one of us, and so we want to make sure that we are being diligent in our pursuit of care and in our pursuit of health. All right. So before we go, yes, God, thank you, because we're gonna pray. We can crank that. We're gonna pray a little bit. I want to, and you all are welcome to go ahead down if you want, or if you want to stay up for prayer, you're welcome. But we're gonna pray.